From now onwards, we are going to do some videos. We are talking about the things which people mostly suffer, how to take care of them before going to the hospital, certain things, the food, the way you can take care at home, and the things for the treatment. If you don't have to come to the hospital, what you can do, or if you don't have a hospital nearby, what at least you can do. We are going to talk about this. So today we are going to talk about gastritis. Most people call it as acidity. Many people get pain here, which is epigastrium. People get acidity problem, and some people, they don't even know that this is acidity. There's some people when they come to our hospital and we ask them, are you getting acidity? And they say, no, I'm not having acidity. I don't have it anymore. But during the examination, we find this patient has acidity. So usually if you have a burning pain in your epigastrium, the chest area, and sometimes it also comes with chest pain, which actually it also can radiate to left or right side of your chest, which can be misdiagnosed as a chest pain due to angina or heart attack. Most people get actually agitated and get scared, so they come to the hospital. We find out this is just acidity and gas. So gastritis is a very common thing in general population, and there's nothing to be scared of. There are some reason people get these acidity problems, and there's always a treatment for them. Number one, if you do not take care of your food properly, like if you skip meals for longer times, or you eat junk food, oily food, foods with spices, masala, all this thing a lot, and your stomach cannot digest it properly, you start getting acidity. And those are actually hyper acidity in your stomach. Our stomach have hydrochloric acid, which actually help our food to be digested. So when you eat this kind of thing, it increases the level of acidity, and it actually damages the inner part of mucosa, means inner part of the wall of your stomach, or the next part, duodenum, and it actually hurts. Now there are people, they are also taking lots of medicine because of their pressure. There are heart medicine, there are patient with osteoporosis, there are patient with kidney problem, diabetes, and due to those tablets they are taking, sometimes they cause acidity. So we always combine a PPI or H2 blocker, which actually used for reducing the acidity level. So another reason for acidity is a very common one, which is H. pylori, Helicobacter pylori infection. Now Helicobacter pylori is the type of bacteria which remain in your stomach, and usually contaminated by the contaminated water. When you drink it, when you touch it, and you accidentally it goes inside your mouth and it reaches the stomach, and it lives there. It lives even in high acidity, they can survive, and they produce more and more acid, and which cause acidity, and eventually you end up with the ulcer. Now if you don't treat them, it actually changes to cancer and everything. So whenever you are having acidity or problem in epigastric pain, go to a doctor, and the doctor will tell you if there is a need of giving any medicine. But during this pandemic situation, what you can do at home is avoiding anything which is oily, anything which is sour food or acidic food, soda and all this thing you have to avoid completely. You have to skip, you have to avoid staying fasting. Like if you fast more, your acid level will go increase, and it will start giving you pain. So you have to careful about what you eat. And during the pain, some people, what they do, they drink milk. Do not do that, because it actually hurts your stomach even more. It actually damages your wall. You can do one thing, you can have ice cream which is like a vanilla or something, or you can have yogurt. That's a very good thing when you have acidity. Um, there are also things like drinking more water frequently. They actually help. Some people actually get it while they are eating the food, and some people they get relieved after eating the food. So there is a difference between the gastric ulcer and peptic ulcer, or there is a duodenal ulcer. They actually happen when you have already gastritis is continuing for some time, and you end up with a ulcer problem. So we are going to talk certain things like that everyday basis, and just follow my YouTube channel. Will be continually post something like that. You or your some friend, some relative may be suffering from one of these things, so you can share with them. At least you will be able to fulfill what exactly we are trying to do. So don't forget to subscribe. Just press the red button down and just follow me, and so that you can get the message immediately whenever I put a new video on YouTube. Take care of yourself. The outside is really not good right now, and you just have to be very careful about mask, using a sanitizer, and take always a bath. Keep yourself clean, and take care of yourself, and you have a good day.